Welcome to the deep dive. Today we're venturing into a topic that might sound a bit technical, but is really crucial if you got canine companions. We're talking about epididymitis and orchitis.
Hmm.
Simply put, it's about inflammation. So epididymitis, that's when the epididymis, that coiled tube behind the testicle that stores sperm, gets inflamed.
Right.
And orchitis is inflammation of the testicle itself.
Exactly. And, sometimes they happen together. Vets have a term for that,
Yeah,
Epididymitis.
right. Makes sense.
Yeah. And we've gone through some pretty detailed medical info to bring you the key stuff, what causes these things, the warning signs you should look for, how vets actually figure it out, and importantly, the treatments.
So the idea is to give you a really solid understanding so you can be, well, proactive about your dog's health.
Verizon.
Okay, let's dive right in. Our sources lay some groundwork, and one thing really jumps out immediately. Epididymitis can actually be a major red flag for something more systemic called brucellosis.
Yeah, that's a big one. Brucella canis, it's a bacterial infection. And it unfortunately has this knack for affecting the reproductive system in dogs. Inflammation of the epididymis is often one of the first and maybe most obvious signs.
Okay.
The information also makes a distinction between, acute cases, which often happen because of direct injury, like a knock or some trauma to the scrotum.
Ouch. Yeah, that makes sense. A direct hit causing swelling. But what about the chronic kind? How does that usually develop?
Well, chronic inflammation can be a bit more sneaky, I guess. It develops over time, often linked to underlying infections or other factors we can get into.
Okay.
And it's interesting, this inflammation isn't always just stuck in the epididymis and testicle. It can sometimes spread out to the surrounding tissue layers, kind of like the wrapping around them. That's called periorchic epididymitis.
So it can spread beyond the main parts. Now, who usually gets this? Is it like certain breeds or more general?
That's one of the interesting points. Well, it's not exactly rare in dogs. It's actually very uncommon in cats.
Really? Cats don't get it much.
Seems not. And it doesn't look like specific genetics or breeds are particularly predisposed. The average age they see is around, 3.7 years. But the range is really wide, from pups under a year old up to 10-year-old dogs.
Wow, okay. So it's something that could potentially affect, well, pretty much any adult dog.
Yeah, it seems that way, yeah.
So for dog owners listening, what should we be looking out for? What are those telltale signs?
Okay, several key things. Obviously, swelling in one or maybe both testicles. That's a big one.
Right.
If it's acute, sudden, it'll probably be painful if you touch it. You might also notice your dog licking at their scrotum a lot.
Trying to soothe it, I guess.
Probably. But that licking can actually cause its own problems, like skin irritation, dermatitis, down there.
Ah, okay.
And more generally, your dog might just seem off, unusually tired, listless, maybe not eating much, reluctant to walk, or if they're intact, maybe no interest in breeding. Sometimes you might even see an open wound or an abscess forming. Yeah. And then there are less obvious things too, like infertility or even a fever. Basically, any of these changes warrant a vet visit.
Definitely sounds like a collection of signs that would set off alarm bells. Okay, let's dig into the why. What actually causes these problems? The source material listed quite a few possibilities.
It really does. Like we mentioned, Brucella canis is a major player. The text specifically notes it likes to settle in the tail of the epididymis, so that's a really key infection to know about.
Okay, Brucella first. What else?
It's not the only infection, though. Other big systemic ones, like distemper or even Rocky Mountain spotted fever, can sometimes be involved.
That makes sense. Things that affect the whole body could easily impact that area, too. What else is on the list?
Another big category is what they call ascending infections. Think of it like an infection starting lower down, maybe in the prostate or the bladder.
Like prostatitis or cystitis?
Exactly.
Yeah.
And then it travels upstream into the reproductive tract. This is especially common with brucellosis affecting the prostate.
Okay, so infection moving upwards.
Right. Then there's a slightly less common but kind of fascinating cause. Retrograde urine contamination.
Retrograde urine.
What's that? Imagine a sudden spike in pressure inside the abdomen, maybe from like car trauma or something significant.
Okay.
That pressure could potentially force urine backwards into the vas deferens, the tubes that carry sperm, and that urine backflow. It can cause serious irritation and inflammation.
Wow. Never would have thought of the connection.
It's pretty specific.
Okay.
Then you've got the more straightforward stuff. Direct injuries, blight wounds, puncture wounds to the scrotum.
Right.
And the text lists the usual bacterial culprits you might find if those get infected. Staph, strep, E. coli, proteus, even mycoplasma.
Standard wound bacteria.
Pretty much. Then there's another interesting angle. the body's own immune system. Sometimes it can get confused after, say, an injury or initial inflammation and start attacking sperm cells as if they were foreign invaders.
An autoimmune reaction.
Exactly. And finally, they mention a specific link found in beagles sometimes. An autoimmune thyroid issue in that breed can show up alongside orchitis.
Huh. So it's a really broad spectrum, isn't it? External injuries, infections traveling up, systemic diseases, even the body attacking itself. How does a vet sort through all that? How do they diagnose it?
Well, the first step is usually ruling out other things that look similar. The text mentions several differentials like an inguinal hernia.
A hernia near the scrotum.
Right, or just scrotal dermatitis skin inflammation. Could be torsion where the spermatic cord twists.
Ooh, that sounds painful.
Very. Or hydrocele, which is fluid buildup, a sperm granuloma like a lump of sperm, or even testicular cancer. And of course, prostatitis or cystitis, those infections we mentioned earlier. So a thorough physical exam is really ground zero.
Okay, start with the exam, rule things out. What tests come next?
Standard blood work, a CBC, biochemistry profile, and a urinalysis are pretty routine.
What do those show?
They can give clues, like a high white blood cell count might suggest a general infection somewhere. If the urine shows pus or blood or extra protein, that might point towards the urinary tract, maybe the prostate or bladder being involved.
Makes sense. And given how central Brucella canis seems to be, I bet there are specific tests for that.
Absolutely. The text really stresses this. Any dog showing up with scrotal enlargement, test for Brucella immediately.
Okay, what kind of test?
Often the first step is a rapid slide agglutination test. It's like a screening test. It's sensitive good at picking up potential positives, but it's not perfectly specific, meaning it can sometimes flag positive even if the dog doesn't have it.
So a positive screen needs follow-up.
Definitely. The source mentions one specific screening test, the D-test-TB from Zoetis. But if that comes back positive, you need confirmation. The gold standard is often an agar gel immunodiffusion test, AGID. Specialized labs like Cornell's Diagnostic Lab can run that.
Got it.
And sometimes they might culture bacteria from the blood or maybe a lymph node sample to be absolutely sure.
So blood tests, specific Brucella tests. What about looking inside? Imaging.
Yeah, imaging, especially ultrasound, is super helpful. You can ultrasound the prostate gland, particularly if you suspect an infection traveled up from there.
Right.
Plus, ultrasound can help guide a needle if you need to take a sample, like an aspirate, for cytology or culture.
And ultrasound the tests themselves, too.
Oh, definitely. Ultrasound of the testes in epididymites can show changes typical of inflammation. You might see patchy, darker areas, hypoechoic areas in the testes. The epididymites might look irregular, maybe swollen, with different shades of gray, hypoechoic or even hyperechoic spots.
So it gives a visual picture
Yeah.
of the inflammation.
Exactly. And taking measurements during the ultrasound is really important too, so you can track whether things are getting better or worse over time.
Okay. Are there other ways to get samples directly from the area?
Yes, several. If you can collect a semen sample, that can be incredibly useful.
What do you look for in semen?
You examine it under a microscope for inflammatory cells, for bacteria, and also for sperm abnormalities, things like coiled tails, detached heads. With Brucella canis specifically, you might see this weird head-to-head clumping, agglutination of the sperm.
Interesting. What else?
If a prostate infection is suspected, the vet might do a prostatic massage and collect fluid that way, usually via catheter, for analysis and culture.
Okay.
Any open wounds on the scrotum, definitely swab those for culture to see what bacteria are growing. And in some cases, you might use a fine needle aspiration to take a tiny sample directly from the enlarged testicle or epididymis.
For cytology and culture again?
Right. Look at the cells. See if you can grow bacteria. The text even notes that, unfortunately, if an animal passes away, examining tissues post-mortem, like from the uterus and spleen in females, or the prostate in males, can sometimes help confirm the diagnosis and understand how far an infection like Brucella spread.
Wow, that's a really comprehensive diagnostic approach. So once you have a diagnosis, what happens? What are the treatments?
Well, the treatment path often hinges on one key question. Is the dog intended for breeding? Is fertility a concern?
Ah, okay. So what if fertility isn't the goal?
If future breeding isn't planned, the usual route is, first, get a culture if possible to guide antibiotic choice. Then, stabilize the dog medically if they're really sick. Give antibiotics before surgery.
Why before?
Good question. It helps prevent a complication called serous cord, basically, a chronic inflammation and hardening of the spermatic cord stump after castration. So, pre-op antibiotics, then castration removing both testicles.
Okay, that makes sense if breeding isn't an issue. What if the owner does want to preserve fertility? Maybe only one side is affected.
Right. In that situation, if it's truly just unilateral orchitis and the cause allows for it, removing only the affected testicle, unilateral castration might be an option. Again, with preoperative antibiotics.
But does that guarantee fertility?
That's the crucial point. Even if only one side seems affected, or even after removing one testicle, the dog's future fertility can still be, well, iffy. It's definitely not guaranteed.
Okay. What about the actual medications? Antibiotics, especially for brucella.
Yes, since brucellosis is such a focus, the text details treatment for it. It mentions that using a combination of antibiotics often works better than just one single drug.
Combination therapy.
Right. And ideally, you'd base the choice on culture and sensitivity results, if you have them, so you know which drugs will actually kill the specific bacteria.
Makes sense.
But, and this is really important, the text emphasizes that completely eliminating Brucella canis bacteria can be extremely difficult.
So even with treatment?
Even with treatment, clearing the infection entirely is tough. That's why they strongly recommend reproductive sterilization, castration, or spaying, even after antibiotic treatment for brucellosis to prevent further spread.
Wow. Okay. What antibiotics do they mention?
They list a few combinations that have shown some success. Doxycycline is one, often combined with an injectable like gentamicin, which has a specific dosing schedule over several days, sometimes repeated. Rifampin is another possibility, and rofloxacin. Treatment usually needs to be long-term, like 1 to 3 months.
That's a commitment.
It is. And while the source didn't list specific contraindications or drug interactions, any vet would obviously consider the individual dog's overall health before starting such a regimen.
Right, of course. So treatment can be pretty intense, especially with brucellosis. What's the long-term outlook after all this? What can owners expect?
Yeah, the prognosis for future fertility is generally described as guarded to poor, especially if both sides were involved initially.
Guarded to poor, not great odds.
Not really. And remember how we talked about even unilateral issues? The heat generated by inflammation in one testicle can actually damage the other, supposedly healthy one. It's called testicular degeneration due to heat. So even removing the bad one doesn't automatically save the good one's function.
So the inflammation itself causes broader damage.
Would seem so. The text also mentions potential long-term problems like blockages in the epididymis from the inflammation, which can lead to things like a spermatocelia, basically a cyst filled with sperm, or a sperm granuloma, which is like a lump formed by the immune system reacting to leaked sperm.
More complications down the line.
Potentially. That's why it's generally recommended to do a semen evaluation about 3 months after treatment finishes, just to see what the actual impact on fertility has been.
It really highlights how vital it is to catch these things early and get proper vet care, doesn't it?
Absolutely. Epididymitis, orchitis, they can stem from so many different things. And like we've covered, getting that prompt veterinary attention is just key for figuring out the cause and getting the best treatment plan going.
And for all of us listening with dogs, it really just boils down to being observant, paying close attention. Any swelling back there, any signs of pain or discomfort or just changes in how your dog is acting, especially around their nether regions, that should definitely trigger a call to the vet.
Exactly. And when you think about that whole range of causes of bacteria invading, physical trauma, even the body's own defenses kind of going rogue, it really shows you what a delicate system the canine reproductive tract is and how complex their body's responses can be. It kind of makes you wonder, doesn't it? What other really intricate mechanisms might be going on in there, defenses or vulnerabilities that we maybe don't fully grasp yet?
That is a really interesting thought to end on. Thanks so much for breaking all this down for us today.